If you have diabetes and plan to have a baby, you should try to get your blood glucose levels close to your target range before you get pregnant. Staying in your target range during pregnancy, which may be different than when you aren't pregnant, is also important. High blood glucose, also called blood sugar, can harm your baby during the first weeks of pregnancy, even before you know you are pregnant. If you have diabetes and are already pregnant, see your doctor as soon as possible to make a plan to manage your diabetes. Working with your healthcare team and following your diabetes management plan can help you have a healthy pregnancy and a healthy baby. Plan to manage your blood glucose before you get pregnant. If you develop diabetes for the first time while you are pregnant, you have gestational diabetes. How can diabetes affect my baby? A baby's organs, such as the brain, heart, kidneys, and lungs, start forming during the first 8 weeks of pregnancy. High blood glucose levels can be harmful during this early stage and can increase the chance that your baby will have birth defects, such as heart defects or defects of the brain or spine. High blood glucose levels during pregnancy can also increase the chance that your baby will be born too early, weigh too much, or have breathing problems or low blood glucose right after birth. High blood glucose also can increase the chance that you will have a miscarriage or a stillborn baby. 1. Stillborn means the baby dies in the womb during the second half of pregnancy. How can my diabetes affect me during pregnancy? Hormonal and other changes in your body during pregnancy affect your blood glucose levels, so you might need to change how you manage your diabetes. Even if you've had diabetes for years, you may need to change your meal plan, physical activity routine, and medicines. If you have been taking an oral diabetes medicine, you may need to switch to insulin. As you get closer to your due date, your management plan might change again. What health problems could I develop during pregnancy because of my diabetes? Pregnancy can worsen certain long-term diabetes problems, such as eye problems and kidney disease, especially if your blood glucose levels are too high. You also have a greater chance of developing preeclampsia, sometimes called toxemia, which is when you develop high blood pressure and too much protein in your urine during the second half of pregnancy. Preeclampsia can cause serious or life-threatening problems for you and your baby. The only cure for preeclampsia is to give birth. If you have preeclampsia and have reached 37 weeks of pregnancy, your doctor may want to deliver your baby early. Before 37 weeks, you and your doctor may consider other options to help your baby develop as much as possible before he or she is born. How can I prepare for pregnancy if I have diabetes? If you have diabetes, keeping your blood glucose as close to normal as possible before and during your pregnancy is important to stay healthy and have a healthy baby. Getting checkups before and during pregnancy, following your diabetes meal plan, being physically active as your healthcare team advises, and taking diabetes medicines if you need to will help you manage your diabetes. Stopping smoking and taking vitamins as your doctor advises also can help you and your baby stay healthy. Work with your healthcare team. Regular visits with members of a healthcare team who are experts in diabetes and pregnancy will ensure that you and your baby get the best care. Your healthcare team may include a medical doctor who specializes in meters and diabetes care, such as an endocrinologist or a diabetologist, an obstetrician with experience treating women with diabetes, a diabetes educator who can help you manage your diabetes, a nurse practitioner who provides prenatal care during your pregnancy, a registered dietitian to help with meal planning, specialists who diagnose and treat diabetes-related problems, such as vision problems, kidney disease, and heart disease, a social worker or psychologist to help you cope with stress, worry, and the extra demands of pregnancy. You are the most important member of the team. Your healthcare team can give you expert advice, but you are the one who must manage your diabetes every day. Talk with your healthcare team before you get pregnant. Get a checkup. Have a complete checkup before you get pregnant or as soon as you know you are pregnant. Your doctor should check for high blood pressure, eye disease, heart and blood vessel disease, nerve damage, kidney disease, thyroid disease. Pregnancy can make some diabetes health problems worse. To help prevent this, your healthcare team may recommend adjusting your treatment before you get pregnant. Don't smoke. Smoking can increase your chance of having a stillborn baby or a baby born too early. 2. Smoking is especially harmful for people with diabetes. Smoking can increase diabetes-related health problems such as eye disease, heart disease, and kidney disease. If you smoke or use other tobacco products, stop. Ask for help so you don't have to do it alone. You can start by calling the National Quit line at 1-800-QUIT-NOW or 1-800-784-8669. For tips on quitting, go to smokefree.gov. See a registered dietitian nutritionist. If you don't already see a dietitian, you should start seeing one before you get pregnant. Your dietitian can help you learn what to eat, how much to eat, and when to eat to reach or stay at a healthy weight before you get pregnant. Together, you and your dietitian will create a meal plan to fit your needs, schedule, food preferences, medical conditions, medicines, and physical activity routine. During pregnancy, some women need to make changes in their meal plan, such as adding extra calories, protein, and other nutrients. You will need to see your dietitian every few months during pregnancy as your dietary needs change.